Okay, so we are live here. Myself, Dr. Anum Zahir. I am a MD, homeopathic consultant, owner director at Homeopathy Heals. I welcome all the viewers, my Homeopathy Heals family, to this Insta live video. So today we are here to discuss the topic how to prepare for MD entrance and other UPSC examinations for homeopathic medical officer. Am I audible to you all? Please do let me know for a good interactive session. Very good afternoon. In this session, I'll brief you. I'll be telling you about the syllabus. I'll be telling you about the preparations. I'll be telling you about the books. I'll show you my books by which I have prepared for the examination. I'll tell you about the do's and don'ts, and I definitely hope that this session is going to help you to rock all the entrance exam you give, irrespective of doing MD or any competitive exam. Okay, thank you so much, Mr. Nakvi. I'm audible. Okay, so before we start, I think it's mandatory to say that if you have not yet subscribed our YouTube channel, hit the bell icon, number one. Number two, I have got request that we are going to start Friday videos on Facebook. Very soon, some students, they miss weekly Friday videos, so we'll be starting them. Another thing is, this February is full of guest talk live with Homeopathy Heals. So do not forget to follow the account homeopathy.heals. And something exciting is coming to us this February, so you stay tuned. Okay, so without wasting the time, we should start. Now, in between, if we start, if you have any question, please drop it down in the comment section. Before going further, I'll try to solve all the possible questions I could. Okay. Hi everybody who is waving. Okay, so now my first question is doing MD is mandatory? Okay, so so many students, so many people, they are asking me कि मैंने MD क्यों किया, and is MD करना ज़रूरी है क्या, MD क्यों करते हैं, MD में क्या करते हैं. Okay, तो चाहे MD हो या कोई भी entrance exam हो, okay, you should be clear what you want from your life, from your career. Okay, so doing MD per se just for practice purpose, I don't think it is fruitful, because I have seen some of my colleagues, they are just BHMS and they have flourished, matlab 3 and 4 clinics across the city, and they are very renowned. So number one thing, never ever think of doing MD just for practice purpose. Okay, giving 3 years to MD just for the practice, better you settle your practice. 3 years is a huge time. Okay, number two, what are the benefits MD करने के, क्यों करें MD, क्या मिलता है MD करके. Okay, so if you are more into research thing, okay, if you want to know how other detailings, okay, कुछ लोग ऐसे भी बोलते हैं कि मैम हमारे बेसिक्स क्लियर नहीं है तो हम MD कर लेते हैं, 3 साल और पढ़ लेंगे तो हमारी प्रैक्टिस अच्छी हो जाएगी. दिस इज़ नॉट एक्चुअली, दिस इज़ नॉट डन. ओके, प्रैक्टिस अच्छी तभी होती है जब हम लोग क्लिनिकल प्रैक्टिस करते हैं, हम अपनी गलतियों से ही सीखते हैं. ओके, मैनी ऑफ यू हैव आस्क्ड के अभी भी आज भी मैंने 2 फॉलोअप्स डाले थे मेंस्ट्रुअल कंप्लेंट्स के, एमेनोरिया और मेनोरेजिया के. So I have also learned from my mistakes. It's not that I have not done mistake. I remember I have prescribed arnica where I should have, or I would have prescribed rustox. Okay, because that was not clear, है ना. Even everybody is a beginner, so we learn from our mistakes. कहीं सीखने जाने की, किसी के पास सीखने की ज़रूरत नहीं है. Okay, so you start practicing. Forget basics. Okay. पढ़ाई करते जाइए, प्रैक्टिस शुरू करते जाइए, बेसिस अपने आप स्ट्रॉन्ग हो जाएंगे. Another thing is for the research purpose. Definitely, if you want to be somewhere research officer or in research and development for homeopathy, you have to do MD. Yes, somebody is saying for lecturer, yes, you need to be MD. If you want to be in teaching line, doing MD is mandatory. Okay, so there is no shortcut, so you should be very much focused about this. इसके अलावा there are certain other options after BHMS which you can opt. Okay, you can do specialization, like you can do Masters in Public Health, MPH, Masters in Public Health. Okay, some people they opt for MBA also after BHMS. So it's all up to you what you want from your life. Okay, do whatever makes you feel happy, do whatever doesn't feel like you. Your bread and butter should not feel like a burden to you, that every day you have to get up in the morning, go to the clinic or to the office, coming back after 9 hours. No, that is not the meaning of career. You every day you get up with the zeal and enthusiasm and you do your work as your love. Okay, now when we prepare for any competitive exam, number one, the first key is we should know our syllabus. Okay, before I start about this step by step, I'll tell you I cleared my MD in 2015 and I gave 2 exams. Okay, I gave one Bharati Vidyapeeth Homeopath regular for MD entrance. I got rank number 1, and I gave Maharashtra AI PGT and my rank was 23 in that, all India. Okay, so 23 or 27, my rank was so good, matlab. Okay, so last year also I cleared UPPSC Homeopathic Medical Officer entrance exam, and last year I appeared for interview as well. Okay, so whatever exam you are giving, okay, you should know the syllabus. Like in syllabus we have clinical subjects and we have non-clinical subjects. Okay, in clinical subjects we have medicine, surgery, gynae, ops. Okay, and we have homeopathic subjects as well. Like we have organon, materia medica, repertory, and case taking. So we should be very clear. Okay, that what we are going to do with that. Okay, what is the syllabus, what we have to prepare. For example, we have materia medica, but I would suggest the best book to study materia medica from the practice and for the competitive point of view is this. I'll tell you one incident. I started preparing for MD in my internship. Okay, in internship I got clear that I have to do MD. And why I have to do MD? Because I have to land up in teaching time. Okay, so I was doing my internship, and I would like to take name and thank Dr. Yashveer Singh. Sir is head of surgical department in State Homeopathic Medical College, Moradabad, Uttar Pradesh. He was the man behind this, my strong materia medica. He gave me the target simple. He said, just read 5 drugs every day from Allen Keynote. I just started my internship, and he said revise the previous one 5 and then go to next day to the new 5. And as soon as you complete this, you'll find that your MD syllabus is completed. So this is the, I must say, a cheat key. Sir gave it to me. Thank you so much, sir. You have shaped my life. If you ever see this live session. Okay, so this Allen Keynote has all the answers, questions asked in competitive and entrance exam. Okay, and you see there are so many tricky questions are given, है ना? Even the questions asked are as it is written in Allen Keynote. For example, I'll show you. Open page number. If you have Allen Keynote, open page number 157. On page number 157, ipecac is given. Okay, and there is a 4th symptom is there. Pains as if bone were all torn into pieces. अगर आपसे कोई पूछेगा pains as if bones are torn into pieces, what you will think about? Rustox, पहला option. दूसरा option ruta. तीसरा option symphytum. 4th option is ipecac. So only those who have studied Allen's Keynote properly, they'll be able to answer. They might have asked number 1 ipecac, number 2 eupatorium perforatum, number 3 ruta and rustox. Okay, and there is a comparison given as if broken. So here the question changes. If in the exam it is asked pain as if all bones are broken, the answer is eupatorium perforatum. I'll tell you one thing, you know, हमें ऐसा लगता है कि एग्ज़ाम बहुत टफ है और एग्जामिनर ने ऐसा बनाया है सब फेल हो जाएं, पर आई हैव ऑल्सो टेकन वाइवाज, आई हैव ऑल्सो सेट द पेपर्स, एग्जामिनेशन पेपर्स, इंटरनल्स ऑफ कॉलेज. पेपर ऐसा बनाया जाता है जिसे 50% स्टूडेंट्स पास कर सके. एक अच्छा टीचर हमेशा हमेशा मैंने ये देखा है जिसे 50% पास कर सके. इसके अलावा जो 30% है वो मॉडरेट बनाया जाता है, मॉडरेट, जिसे अच्छे स्टूडेंट्स पास कर सकें, दिल गेट 80%, 70% मार्क्स. लेकिन सिर्फ पेपर 20% या 10% हार्ड रफ इसलिए बनाया जाता है सो दैट द ब्रिलियंट स्टूडेंट्स, द हार्ड वर्किंग स्टूडेंट्स, they come up with glorifying and flying colors. Okay, so what we have to do, we have to focus upon only those 10% questions. Okay, so what we do as a homeopath, we give more importance to our subjects, philosophy, homeopathic material, but the 10%, that tough paper is made from clinical subjects, the allied subjects, which we usually miss. The maximum portion of any exam, it is made up of from community medicine, practice of medicine. Then comes surgery, then gynae obs, and from anatomy physiology, I guess one question is asked, barely two. So you need to know about your syllabus and the number of questions that will be coming, how many questions from each subject is coming. Then we have to focus upon the important subjects or important topics. Okay, for example, I'll take example of repertory. Okay, if you have to prepare for competitive exam for the subject repertory, what all points you need to know about repertory is, number one, you need to know all the origin and backgrounds, full name. I have been asked full name of therapeutic pocket book multiple times. थेरेपेटिक पॉकेट बुक का पूरा नाम हम लोग टीपीबी ही बोलते हैं, बाय बोनिंगहाउसन, बट एक्चुअली इसका पूरा नाम ये नहीं है. दूसरी चीज़, ईयर ऑफ पब्लिकेशन, मीनिंग ऑफ द रिपर्टरी, द बेसिस फिलोसफी ऑफ द रिपर्टरी, ग्रेडिंग ऑफ रूब्रिक्स, ग्रेडिंग ऑफ इवन रेमेडीज, बहुत ज़्यादा पूछा जाता है, व्हाट इज द ग्रेडिंग ऑफ remedies in therapeutic pocket book. Drop me in the comment section if you know this. Okay, computer repertories, about card repertories, different card repertories, their year of publication or origin. Few rubrics are also asked, like awkwardness is where it is found in Boger Bonninghausen characteristic repertory. And सबसे पहले they'll give mind, then they give sensation, then extremities, and उसके बाद they'll give generalities. Okay, so you let me know which multiple choice you will take. Now when I talk about pharmacy, what kind of questions you have to prepare, like drug preparations, all the pharmacopoeias, you should know the source of drugs, rules how they are prepared, the classes, and what are the regulations. Be up to date if there is any new act regarding drug cosmetic act it is, or bio you find any act, then they are very much useful for the competitive exams if you are appearing for UPPSC or any state level medical officer exam. Okay, now comes to the community medicine. If we have social and preventive medicine, we should be very much thorough about the epidemiology. This is very important, because when you are medical officer in any PHC, physical health center, or community health center, so epidemics it is, and these days so it is very much coming up. So you need to know all about sign and symptoms, their prevalence and incidence, what are the latest parameters which government is taking, the literacy rate, the life expectancy, the population. Okay, and these all important topics, and a little bit of biostatistics. When we appear for this research officer, CCRH, Central Council of Research Homeopathy research officer, they'll ask, there is a exam, small portion of biostatistics is also asked, mean, median, mode, the standard deviation, and so many questions. Next is, we should know about the exam pattern. Before coming up to this, we should answer few of the questions. There are so many questions asked. I hope you all are enjoying the session. You are being with us. Okay. I'm looking for the questions. शुभांगी इज सेइंग मैंने अभी BHMS में एडमिशन लिया है. विश यू ऑल द बेस्ट शुभांगी. Many laurels to you. May you become upcoming pioneer and stalwart of homeopathy. Just be true to it. Devote yourself. Homeopathy 13 page is asking, is there any separate exam to join civil after BHMS, or do I have to take regular UPSC exam? Dr. Sahab, you have to take the regular UPSC exam. In your optional subject, you can opt for homeopathy. Rest, the all exam, the pre, the mains interview will be the same. Wish you all the best if you are giving a thought of giving civil examination. Okay. Warrior Sanaira is asking, and in how many parts we can divide that medicine? Which medicine you are talking about? In piles and acne, most important in case taking. If you want to learn about case taking, I have made 5 videos and they are available on my Facebook page Homeopathy Heals and YouTube channel as well. You can go there, search for it, and you can enjoy 1 hour of very informative learning session about case taking. What to do, ma'am, जब बहुत टाइम का गैप हुआ और प्रैक्टिस करना है तो see, you have to start from somewhere. Dr. Asma Rulani is asking, see, you have to start from anywhere, है ना. और टाइम चला जाएगा अगर ऐसे ही बैठे रहेंगे. इट्स ओके टू फेल, इट्स ओके टू सप्रेस, इट्स ओके दवाई काम ही नहीं करे. व्हाट यू विल डू, यू विल स्टार्व हार्डर, टू नो कि अब क्या करें. यू विल सीक फॉर हेल्प, यू लर्न, यू विल ओपन द बुक्स. दैट इज ऑल वी वॉन्ट. स्टार्ट फ्रॉम सिंपल केसेस. आपसे कोई नहीं कह रहा कि बहुत लंबा टाइम हो गया एंड यू स्टार्ट टेकिंग ऑटो इम्यून डिसऑर्डर्स एंड कैंसर केसेस. दैट्स ओके, दैट्स ओके. We all know the basics, we all know the cardinal principles, and homeopathy is same for us. It's a mathematics. 2 + 2 is 4. 2 + 2 गलती से भी 5 नहीं हो सकते. And homeopathy is as simple as that. Okay, BHMS after dermatology course. Yeah, some institutions, they offer dermat courses, and I think it has a very good scope because we have so many skin complaints in our practice. Pragya Paramita is saying, ma'am, I have joined state KGK this week. Wish you all the best, Dr. Pragya. And I have got a lot from college, so definitely you will be benefiting from this. I passed out in 2015. 2015 is okay. You start the practice. Okay, and if you need any help, you can inbox me your cases. There's no problem. Okay, Neha Sheikh is saying salam. Walaikum assalam, dear. Okay, so we'll continue with this. Now, the step 2 is you have to know about the exam pattern. Okay, what exam you are giving. You are giving MD entrance, so it is having either it is having your exam is having negative marking or not. Okay, many exams they have 1/3 negative marking. Okay, so जितने ठीक नहीं होते उतने गलत हो जाते हैं. So better you don't attempt the questions in which you are not at all sure about it. Number 3 step is you need to learn the time management. This is very important. हमें बहुत कुछ आता है एग्जाम में. ये सिर्फ MD के एंट्रेंस के लिए ही ज़रूरी नहीं है. हमें इतना कुछ आता है कि हम बहुत कुछ कर सकते हैं. MD का रिटन एग्जाम के लिए भी यही रहता है. बट दिस इज़ वेरी इंपॉर्टेंट टू मैनेज द टाइम. ओके, यू हैव टू प्रिपरेशन से पहले, एग्जाम से पहले जब हम प्रिपेयर करते हैं तो हम क्या करते हैं, उसमें भी टाइम मैनेजमेंट ज़रूरी है. फॉर एग्जाम्पल आई एम वेरी मच वीक एट क्लिनिकल सर्जरी. ओके, सो अभी मेरे पास एग्जाम में 5 months है. सो बेटर इफ आई डिवोट 1 month फॉर द टॉपिक इन विच आई एम वीक. सो आई एम मैनेजिंग द टाइम. Another thing, this I was told by some teacher, I don't remember. She used to say कि एक ही सब्जेक्ट पूरा दिन नहीं पढ़ना चाहिए. Okay, उससे हम बोर हो जाते हैं और पढ़ाई करने का मन नहीं करता. She used to say study 3 subjects in a day. और अपना फेवरेट सब्जेक्ट सबसे लास्ट में. फॉर एग्जाम्पल माई फेवरेट सब्जेक्ट इज मटीरिया मेडिका. सो व्हेन आई यूज्ड टू स्टडी प्रैक्टिस ऑफ मेडिसिन होल डे. व्हेन आई गेट bored, I used to study repertory, and even bored from repertory, I used to study materia medica at the last. So I covered 3 subjects in a day. So never study one subject. हम सोचते हैं ना 15 दिन एक ही सब्जेक्ट पढ़ेंगे. मेरे हिसाब से ये इतना फ्रूटफुल नहीं रहेगा जितना कि अगर आप एक दिन में 3 से 4 सब्जेक्ट्स भी कवर कर सकें. ओके, The good way to study is you always study new thing, difficult thing in the morning and revise it in the evening. As simple as that. Okay. So next is during preparation. Okay, जब हम prepare करते हैं तो कुछ ऐसे myth हैं, हमें ऐसा लगता है कि हम बहुत अच्छा पढ़ाई कर रहे हैं, बहुत अच्छा तैयार कर रहे हैं. For example, you need to take care of your diet. Okay. So diet में you should eat light at every regular intervals. बॉडी को हाइपोग्लाइसीमिक नहीं होने देना है, बॉडी को हाइड्रेटेड रखना है, बहुत ज़्यादा शुगर कंटेंट या बहुत ज़्यादा हैवी फूड नहीं लेना है विच मेक्स यू स्लीपी. देयर इज अ मिथ कि कॉफ़ी पियेंगे या स्मोक करेंगे तो हम ज़्यादा देर रात भर जाकर पढ़ सकते हैं, बट एक्चुअली दिस इज़ नॉट. आपकी बॉडी जितनी हेल्दी रहेगी, माइंड जितना हेल्दी रहेगा, आप प्रिपरेशंस के टाइम भी और एग्जाम के टाइम में भी उतना अच्छा परफॉर्म कर सकते हैं. सो यू हैव टू ईट लॉट ऑफ वेजिटेबल्स, fruits, whatever available for you, है ना, and wash your face multiple times. Okay, so this will help you to reduce the eye straining. Okay, if you feel like sleeping, yes, this I'll tell you, this is the biggest mistake I guess I have done. Even if I feel like sleeping, what I used to do, I used to study. No, I'll cover this topic, no. If you feel like sleeping, sleep for 15 minutes. You put an alarm and you go to sleep. Everything you have studied, it will go to your ब्रेन इन द हाइपोथैलेमस फॉर एवर. ओके, हमें ऐसा लगता है कि एग्जाम में हम सब कुछ भूल जाएंगे, विच इज़ एक्चुअली नॉट ट्रू. योर ब्रेन वर्क्स 10 times फास्टर इन द एग्जाम. जो हमें याद नहीं भी आना चाहिए, इररिलेवेंट होता है, पहले के एग्जाम का होता है, हमें वो भी याद आ जाता है. ओके, नेक्स्ट इज आई टोल्ड यू द इम्पोर्टेंस ऑफ स्लीप. आप जितना सोएंगे एग्जाम से पहले प्रॉपर, उतना ही आपका एग्जाम में माइंड अलर्ट रहेगा. Number 5th point is revision. Revision is very, very much important for the students who are preparing for competitive exams. Okay, you make small notes because every time it is not possible to go through all the huge books, the syllabus, every time you appear for the exam. Okay, you should practice MCQs. Okay, again and again, because practice makes men perfect. अच्छा, एक टिप और है मेरे पास. जो भी हमारे एंट्रेंस एग्जाम होते हैं उसमें 35 से 40% सिलेबस सेम होता है पिछले पेपर्स का, इसीलिए पिछले पेपर सॉल्व करने को कहा जाता है. ओके, इवन इफ यू आर रॉन्ग एट सम क्वेश्चंस, गो टू दैट पर्टिकुलर टॉपिक, यू रीड दैट टॉपिक एंड यू देन कम बैक टू द MCQs. डायरेक्ट MCQs से स्टार्ट करना इज नॉट गुड. ठीक है. नेक्स्ट इज आई टोल्ड यू दैट गोइंग थ्रू. इसके अलावा वन इम्पॉर्टेंट टिप, एग्ज़ाम में बहुत ज़्यादा मेंटल एक्सर्शन, एंग्जाइटी, एंटिसिपेशन की वजह से हम क्वेश्चंस ठीक से नहीं पढ़ते. हम में सबसे पहले मैं आती हूँ, मैंने हमेशा इतने ब्लंडर मिस्टेक किए हैं. फॉर एग्जाम्पल, I'll quote a question, okay, and you have to answer it. Okay, I quote a symptom: chronic alcoholism. Among which of the following drug is indicated in chronic alcoholism, dropsy and other ailments of drunkards? They reform but are continuing relapsing except sulfur, surinum, tuberculinum and sulfuric acid. क्वेश्चन इतना आसान है. क्रॉनिक एल्कोहलिज्म में ड्रूपसी, अदर एलिमेंट्स ऑफ ड्रंकर्ड. ड्रूपसी है, ड्रंकर्ड्स के बारे में दिया हुआ है. दे रिफॉर्म एंड द कंप्लेंट्स दे आर रिलैप्सिंग. इतने ऑप्शंस हैं, मैंने पढ़ लिया, मुझे पता है इसका आंसर क्या है, लेकिन लास्ट में लिखा हुआ है एक्सेप्ट. मैंने वो एक्सेप्ट नहीं पढ़ा और मैंने फर्स्ट वाला ही क्वेश्चन सल्फर को लगा दिया. लेकिन इसमें सल्फर भी है, सोराइनम भी है, ट्यूबरकुलाइनम भी है, सल्फ्यूरिक एसिड इज नॉट देयर. सो दिस इज अ वेरी कॉमन सिली मिस्टेक वी ऑल डू. क्वेश्चंस को अच्छे से पढ़ें. आप क्वालिफाई करके जंग नहीं जीतेंगे, आप क्वेश्चंस को ठीक से पढ़ के उनको इंटरप्रिटेट करके तब जंग जीतेंगे कि आपने क्वेश्चन को ठीक से समझा. क्वेश्चन बहुत इजी लगते हैं, बहुत इजी लगते हैं, यार ये तो मुझे आता है, आई हैव स्टडीड दिस, बट क्वेश्चन को पूरी तरह से पढ़ना. कभी कभी बीच में नॉट लिखा होता है, विच इज नॉट, और हमें सिर्फ सिम्टम दिखाई देता है, सेंसेशन ऑफ एम्प्टीनेस इन द मॉर्निंग, नॉट नहीं दिखाई देता. सो रीडिंग द क्वेश्चन properly, it is very, 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 very important. Okay, now next is we'll answer some questions, then I'll show you the books. Thank you so much, Dr. Kaushik. He's saying that's the reason I follow you, madam. Accept my gratitude. Books you use for MCQ preparations, I'll come to it. I'll show you all my books for which I have prepared. Such an honest session this is. अजय विश्वकर्मा इज सेइंग मैम आई एम BHMS लास्ट ईयर स्टूडेंट, मेरी इंटर्नशिप स्टार्ट होने वाली है, एक सक्सेसफुल होम्योपैथ कैसे बने, मुझे कैसे होम्योपैथिक प्रैक्टिस करना चाहिए। मुझे तो आज तक ये नहीं पता चला कि व्हाट डू वी मीन बाय सक्सेसफुल होम्योपैथ। होम्योपैथ सक्सेसफुल ही होते हैं इफ यू आर एबल टू रिड्यूस द एलिमेंट्स, इफ यू आर एबल टू एलिवेट द पेन, द एगनी, द सफरिंग्स, यू आर सक्सेसफुल। सक्सेसफुल की डेफिनेशन सबके लिए अलग अलग है। सम पीपल दे वांट मनी, सम पीपल दे वांट फेम, some people they want just blessings. What you want? As I started with the session this, ask yourself what you want from yourself, where you see yourself in next 5 years or 10 years. Okay, so you are in internship. This is the very high time. You have to decide about your career, what you want from your career, whether you want to go for post graduation or which stream of post graduation. If you want to start your practice, are you going to work in a polyclinic, a multi-specialist clinic or an independent practice? So it's all up to you. And successful कैसे होना है वो आपका अपना ही क्लिनिकल एक्सपीरियंस आपको सक्सेसफुल कर देगा। उसके लिए आपको कोई भी एक्सट्रिंसिक सोर्स की ज़रूरत नहीं है। Dr. Shreya Saxena is saying, I'm in 4th year, we can start prepping for MD and MO from this year. Yes, definitely. I think this is the golden year. मुझे भी किसी ने बताया होता कि 4th ईयर से ही शुरू कर देते हैं MD की तैयारी। डेफिनेटली गो अहेड, विश यू ऑल द गुड लक एंड लॉट्स ऑफ ब्लेसिंग्स। थैंक यू सो मच डॉक्टर फातिमा, शी इज सेइंग इन्फॉर्मेटिव सेशन। थैंक यू सो मच डॉक्टर कुलदीप। बुक्स फॉर organ and presentation. I'll tell you, there's a book, ML Dhawale, Principle and Practice of Medicine, ML Dhawale. And I find that organon book, it is so good. You buy it and it is worth buying. My all detailed small queries, my confusions, they have been cleared from that book. Ma'am, repertory subject is good for doing MD. Dr. Navi is asking. Of course, repertory is my second most favorite subject after materia medica, and repertory was my minor subject in the MD. I opt for repertory and I have studied it for like 2.5 years. On the basis of Allen keynote, can we start practice? Of course, if the symptom is present in Allen keynote, it definitely helps the patient, because I think this is the most authentic source book. We have so many source books of materia medica, but this is, if it is written here and if you prescribe on the basis of this, definitely patient is going to be better with your treatment. Phantom is asking, coaching or self-study? You see what you want. I have never done any coaching, nothing. I have always studied on my own. So this is very hypothetical question to ask. Ask yourself if you need extrinsic support. So definitely you can go with the coaching, that competitive environment, or if you have got good teachers are really very blessing. Dr. Adiba is saying, once you told me while going for exam, अच्छे से तैयार होकर जाओ, it brings confidence. Yeah, of course, it comes from inside, and looking good on the day of examination itself is a good feeling and refrains you from all the anticipation and anxiety. शाहबाज आलम जी पूछ रहे हैं, एलन की नोट को कैसे याद करें टेक्निकली? द मोर यू स्टडी, द मोर यू रीड, द मोर you will learn it, and if once you apply it clinically. Okay, see, if you read any symptom, Allen keynote, you forget. Okay, anybody can forget. If I teach you or any of your teacher teaches you, you remember a little bit. But once you prescribe medicine and your patient gets better, so definitely that you will going to learn, and it is forever symptom in your mind. मैम मटीरिया मेडिका के लिए टिप्स दीजिए, बस पढ़ते जाइए, यही टिप है. Iritika 27 is asking, ma'am, how to study PSM in short time for final exam, and please tell some important topics from the subject. ऋतिका जी, यू स्टार्ट, आई टोल्ड यू, एपिडेमियोलॉजी बहुत अच्छे से कर लीजिए, और जो गवर्नमेंट की जितनी भी पॉलिसीज़ हैं और प्रोग्राम्स हैं, एराडिकेशन प्रोग्राम्स हैं, वो अच्छे से कर लीजिए. अनदर थिंग इज़, आई टोल्ड यू दैट लिटरेसी रेट, पॉपुलेशन, द इंडेक्सेस, वो बहुत अच्छे से कर लीजिए. कितने लोगों को घर में कितनी एयर चाहिए, दैट इज़ वेरी इंपॉर्टेंट. दैट फैमिली चैप्टर, वी हैव न्यूक्लियर फैमिली चैप्टर, दैट इज़ वेरी इंपॉर्टेंट. Siddhi Dhanke is asking, ma'am, during BHMS, how to manage MD studies? अरे BHMS में BHMS ही हैंडल हो जाए, MD हैंडल करने की ज़रूरत ही नहीं है, MD अपने आप हैंडल हो जाएगा जब एंट्रेंस निकल जाएगा तो. Which subjects are more important for AI PGT? I told you, see, homeopathic subjects are in our blood, हमारे खून में घुले हुए हैं. So you focus on organon के aphorisms. There comes another important book for organon. You need to know what is given in which aphorism number. If I am asking you accessory symptoms, they are asked active and passive action, of remedies is given, the case taking, idiosyncrasies, you should know it by heart on your tips. This is very, very important. If you make it by heart, none of your competitive exam will be difficult from organon point of view. Okay. Hi ma'am, can autoimmune disorder be cured with homeopathy? Yes, I have treated, and it's been 6 years. Some of the cases, they have not I have not got no return symptom, and patient is completely all right. Definitely it is treatable. Again, can you say, I missed how to prep Alan as your teacher said? You can see in the video, I'll post it. Okay, read 5 remedies every day. The next day you revise these 5 and add another 5. Thank you so much, those who find this session as knowledgeable. किलोइड्स के लिए मेडिसिन, देयर आर सो मेनी मेडिसिन्स. लिखा है एंट्रेंस हार्ड होता है क्या पीजी का? हर एग्जाम का एंट्रेंस हार्ड होता है. इट इज़ ऑल अप टू यू. एनी टिप्स फॉर फिलोसफी? टिप्स फॉर फिलोसफी इज स्टडी, कीप स्टडिंग यार. वंस यू स्टार्ट स्टडिंग, व्हेन यू, आई थिंक ऑर्गेनन को क्लिनिकल प्रैक्टिस में एसिमुलेट करना, उसका क्लिनिकल एप्लीकेशन करना इज मोर इम्पॉर्टेंट. दैट्स द हाउ यू स्टडी ऑर्गेनन. ऑर्गेनन इज जस्ट अ बेसिस. ओके, वेन एवर यू फाइंड difficulty in treating any case, what I do, I open the organon and I find many of the answers. Every time I read organon, I find something new. अरे ये तो पढ़ा ही नहीं था. And just in this small book, not any other book, अरे I have missed this line. I have studied organon so many times, but still I find every time something new. Even if I even if I read it again and again, but every time I'll find something new to study in this. Okay. Now I'll show you the books. Okay, so here comes, we all know about this, Boric. Okay, and why this is important? Because it has a remedy relationship, last में, and Indian drugs. If I ask among which of the following is not an Indian drug, okay, so you need to tick. So there are a few Indian drugs are also given. The remedy relationship is given. So Boric is good for any entrance exam. Okay. Now next book comes. I think most of us they are very much aware of this Dr. V.K. Chauhan book, and it has 3 parts. Part number 1, the solved multiple UPSC MD1. I'll post the pictures of all the book. You need not, or if you want, you can take the screenshot. This is part number 2, and there is part number 3 of the same book, and this is very useful, and I think 90% of the students, they use this. Now next is this book. This is by Dr. Manoj Kumar Singh. It has 4000 MCQs in homeopathy, and it is very useful for UPSC entrance examination, and it has all homeopathic subjects in it. This is a very old book, I guess 6 years old to me, and I have studied it and marked the questions which were wrong. I've told you I have made mistakes. Okay, so whatever the questions, answers, they were wrong, I used to highlight. See, so many wrong answers I used to attempt, but that's okay, na? So this is the target PG. It's an essential MCQs to all homeopathic subjects. It has all the homeopathic subjects, and it is written by Dr. J.D. Patil. Okay, so we have discussed about books. I'll go through more questions if they are before signing out. Dr. Lakshmi is asking which book you used to study organon. The same, this William Boric's student edition and ML Dhavle's Principle and Practice of Medicine. It is very useful. If you want, I can send you the picture of the book. Ma'am, if someone want to start preparing for MD now, and then what should be done? I mean, plan for it. Plan for preparing for MD. I told you, divide your subjects, figure out what is difficult, start studying, clear the MCQs, make small notes for last time revision, and revision is very much important. I have just started clinical practice. I find skin disease difficult to diagnose. What should I do? Eruptions are confusing. I'll show you one book. I have it in my bedside. See, this is Skin Homeopathic Approach of Dermatology, and this is written by Dr. Farooqji Master. I find this book very, very useful, so you should get your copy, and I think this is going to help you, because definitely skin complaints, they are very much difficult to treat. They relapse, and mostly patient comes to you after being drugged, abused by allopathic medicines. Dr. Kaushik is saying, I am confused because nowadays so many ways to do homeopathy. Homeopathy has only one way, that is Hahnemannian method. That's it. There is no other homeopathy I know only about Master Hahnemann's homeopathy that we follow. Prashant is asking, आप DYP के student हो? Yes, I am a DY Patil student. I have pursued my MD Homeopathic Materia Medica, and I was 2015 admin, and I passed out in January 2019. Ma'am, from first year can I start to prepare for MD? हाँ, अपनी पढ़ाई अच्छे से करें. If you learn anatomy, physiology, pharmacy by heart, definitely it is going to help you in the MD. Which software I use? I use homeopathic Firefly, Zomeo, Radar, जो भी मिल जाए, नहीं भी मिल जाए, अगर श्योर शॉट है तो रिपोर्टरी का लिमिटेशन है, जहाँ पे रेमेडी इज इंडिकेटेड, यू नीड नॉट टू रिपोर्टराइज द केस. How to properly understand rubrics and find out during clinical problem, during clinical case taking, you mean. इसके लिए we'll have a session with you in the February, and there's a surprise that how to properly understand rubric. Rathod Suryansh is saying, for clinical subject, which book you use for MCQ preparation other than VK Chauhan? I think VK Chauhan is enough, and there is a one book, it is in my evening clinic. I'll send you the pic. It has so good questions of clinical subjects. I'll definitely post the picture of that book. Tips for female homeopathic doctors. How does it matter for being a male homeopath or female homeopath? You need to be ardent, ambitious, get going for your career. Your sex, your race, your color, your anything cannot stop you from practicing and serving for the society. Today's session is about homeoethics. Be active. It is all about preparation in MD and competitive exams. Dr. Shivani is asking, ma'am, what conflict we take for hair fall? अरे conflict से पहले take thing for the basic things, the nutrition, the stress, the dandruff, any dermatitis, right? Any nutritional compromise body है अगर तो, or there is no hair care, there's so many other things to think about or rule about the management of hair fall before thinking about the conflict. Conflict comes when you come up to the totality, the crux of the case. Okay, Pulkita Agarwal is asking, do you practice monopharmacy or polypharmacy? These days when I asked most of the homeopaths, doctor told that you have to do polypharmacy these days, as we are advanced now, not much healthy as Hahnemann time. See, it completely depend upon the case. I told you, whatever the potency you select. I give mother tinctures, and many of my colleagues वो मेरे से नाराज है because I get results on mother tinctures. See, it's the case which is asking. Okay, if the case is of menorrhagia, I can see the bleeding for month, 40 days, 50 days, I'm seeing it. Okay, and there's nothing I can find in the mind or in the general tea, so definitely giving mother tinctures will help. Okay, sometimes what you have to do, you have to alternate the medicine as well, है ना? So it's not fixed that what you are going to do monopharmacy or polypharmacy. You have to just sustain over the cardinal principles. प्रशांत इज आस्किंग फ्यूचर में BHMS को स्कोप है ना? स्कोप तो इंसान बनने का भी है, हम वही नहीं बन रहे. डेफिनेटली स्कोप है डॉक्टर साहब, इफ यू आर गुड एट योर वर्क, है ना? मैम, I got seat in NIH for UG. I would like to study MD there itself. How can you prepare for it? The way you have prepared for UG, you can prepare for MD as well. Wish you all the luck. Tell us about the tinnitus cases treated with homeopathic medicine. I have treated very few, and remedies which helped me, I told you the similimum deeper remedies didn't help me. Chininum, ars, cadmium sulf helped me a lot in cases of tinnitus. Okay, and definitely overall picture, the patient was of calcarea carb nature, similimum. I gave calcarea carb, there was no improvement, so I have to come to rare remedies. I got help, chininum sulf and cadmium sulf. But Q is physiological dose, so it's not affect the mind. You tell me, if mother tinctures, they alter the mind or not? Asking these questions means there is something, jhol in understanding how homeopathic medicine works. There are so many naturopaths who are practicing homeopathic medicine. What's your view about it? See, I'm not here to judge anybody. If even somebody is a mixopath or a homeopath practicing allopathic medicine, as far as he is contented with his work and serving the society, I'm okay with everybody. I'm nobody to comment on anybody's practice. What are your views in treating with no-sodes? I think I'm very much die-hard fan of no-sodes, and no-sodes help me where nobody comes to rescue. Dr. Kaushik is saying it's time now for homeopathy as people are understanding value for it, and there is no answer in allopathy in main cases. Definitely, patient is coming to you after taking so many alternative or mainstream drugs, lots of investigations, and yes, homeopathy has answers if you are a good homeopath, so definitely you can help such patients. Any homeopathic medicine for removal anxiety just before night of the exam? Night before exam, I think that is very common and we need to enjoy it. I miss those nights in the hostel a lot, and that time will not be coming back to you. And dress up so well. The more anxious you are, dress up so well as if you are going to a reception, not to give an exam. This will definitely help you. Hello Homeocasm. Good wishes. Before 10 years scenario is different from medicine. Books for reading about no-sodes. Definitely we have a book of no-sodes and sarcodes but by Dr. Gaurang Gaikwad Boss, and it is very excellent. I have studied it. I've told you I have completed it in 22 hours, and it is a very good book for studying no-sodes and sarcodes. Okay, so I think I have answered so many questions. So I enjoyed a lot and it was pure bliss to be with you all. And if you have still any query, I'll drop a question box. Do let me know what you have learned from this session, and if you have questions, and we'll definitely let you know. There's a question, homeopathy में gynecology की practice करना सही? हाँ ठीक है, but there's a limitation, no? Homeopathy has a limitation in obstetric cases. You cannot do MTP. You are not authorized unless you don't do the CGO or DGO courses. But gynecological problems, you have PCOD, we have endometriosis, the cyst, the PID, and so many tumors, or the lichorial complaints, the infertility. Definitely homeopathy has scope for gynecological complaints as well. Okay, always welcome. Thank you so much for being such a lovely and patient audience. And I would like to tell you that we are coming this Sunday with guest talk with Homeopathy Heals with the new guest and he is master in repertory, and you're going to learn about it. If you want, if you have an idea, or if you want anything topic to be selected for guest talk, do let me know in the comment section. Or okay, there's a question by Homeopathy. Oh, my favorite. What are your views, scope and limitations on digitalization of homeopathy? See, just because of this epidemic, we all are doing online consultations. So I think the patient is not that much scared of connecting to doctor, and all thanks to homeopathy in digitalization. That's why we are taking a lot of online cases and treating patients, and they are doing it so well. Another thing is limitation. See, the art of clinically thoroughly examining a patient, this cannot cannot take place in online consultation. So I think only this is the limitation. Rest, I think it has benefited all the homeopaths across the globe. This something good happened in this pandemic. I got so many cases of cervical lumbar spondylosis. Physiotherapy is asked in these cases, can homeopathic medicine completely cure? Of course, along with the physiotherapy, homeopathy can alleviate their pain, give them relief to a longer extent, in a longer run. How can we manage case miasmatically? मतलब सिर्फ miasm पे ही देना है दवाई, ऐसा नहीं होता. We have to look for the miasm in the whole case. Okay, so if you have a case of psoric miasm, all the symptoms, the journey of disease is psoric, you cannot prescribe Merck, Sol or Syphilinum in that case. So miasm of the case should match the miasm of your remedy. Your experience with leukoderma case? Yes, I have treated, and they are showing really very good results in leukoderma. Something on integration of system? See, we homeopaths are always up for the integration. So other pathies, other system of medicine should be that much prompt voluntarily for the integration. So we are in. We have no problem. The sole aim is to service or to serve the society, to give them best possible healthcare we can give, irrespective of, because you should not forget the ethics. It is whole and soul choice of patient to select what kind of treatment, what mode of treatment he or she wants. So we should stick to the basic ethical principles. Hello mirror, homeopathic mirror. Okay, so it's time for my evening clinic. If you like this session, we'll come back. I think this time is good if you people feel it feasible. So thank you so much. I really enjoyed, and I answered so many questions. I'm feeling so good interacting with you all. Next time we'll have session, and you'll ask questions by coming online. I'll invite you for the video, and so that you can ask your questions. I think next time we'll do that. Okay, and we'll do. I have done this because I have promised when we cross 5,000 followers, when we cross 7,000 followers, we'll definitely call all of you on the live talk, so that you can ask your questions face to face. So thank you so much. It was so great to have you all, for being patient listeners, and don't forget to subscribe YouTube channel and be with us. Okay, till then, stay fit, stay healthy. Homeopathy heals.